we're back. We're live. This is ThinkTech. I'm Jay Fidell. It's the noon hour, and this is Restaurants of Hawaii. We're so interested in covering them because we know how important they are to our daily lives and to our economy and to all the people who work in and around and the investors. It's a huge industry in Hawaii. It has been, and it will be. And the question is getting back to that. So today we have Sheryl Matsuoka. We like her because she is the executive of the Hawaii Restaurant Association, and she has brought with her John Ka'aihui, who is into air purification. So Sheryl, be nice and introduce John, will you?
Yes, it's my pleasure. And thank you again, Jay, for having Hawaii Restaurant Association on ThinkTech. John Ka'aihui is the owner of Hawaii Air Solutions. And John and I have been having these conversations. As you know, science has proven, Jay, that COVID is an airborne virus. And there's so many other airborne viruses, right, that we know is out there along with COVID. So Hawaii Air Solutions is proud to bring active, pure technology to the state of Hawaii. And the implementation of a science-based equipment for indoor air quality is mandatory to ensure the protection and safety of our restaurants' employees, our restaurant guests, and in general, our community. So I'd like to introduce John.
Welcome to the show, John. Nice to have you here. It's important that we cover this technology for a number of reasons. So my first question, which is often my first question, is why?
Yeah, so Jay, thank you for giving me this opportunity, and Sheryl for you as well being here today. So the big why question can simply be answered by not only the pandemic. The technology that I'm going to be sharing today is actually a 10-year-old technology, but as of recent, we know what the COVID-19 pandemic has caused. So our technology is derived from NASA. So NASA actually took this technology and really came to look at it from a space perspective. So what I'm talking about here is how do we grow vegetables and plants in space? Now, when we know a spaceship, we know that it's very confined. There's usually only about 4 to 5 astronauts that can fit in one, say, space shuttle. So when they put this technology in, they looked at space, protecting it from protecting our astronauts that are way up there in space, but also again the technology was really built to plant in space. With this technology, it's a patented product, so there's no other technology like this in the world. All it really does, if I can just explain the technology a little bit, it takes
that would have been my second question.
Okay, great. So it'll take the humidity in the air that's natural, and also the oxygen in the air. And what it does, it actually filtrates through our system. So through the system, what it does is it produces 3 types of molecules. One is hydroxyls, the other is hydrogen peroxide, and superoxides. And what that does is it then gets spit out into the environment that is trying to treat. So your old type of air purifier, or say your non-NASA product, right? All it does is it basically tries to pull all the air into the unit, as opposed to ours is actually sending out the molecules and killing the pathogens, viruses, mold, bacteria in its own environment. And so if you're in a room way in the corner, if one of our devices, say, is spec'd out to 2,000 square feet, which is kind of your average restaurant size, that technology would basically go after that far corner pathogen in the room, under the desk, under the surfaces that maybe human error might miss.
Okay, unpacking. You named a lot of organic chemicals there, and how are those chemicals created? They're not out of thin air. You have to put some stuff in there to get the machine to spit them out, right? What do you have to put into the unit?
Yeah, so the unit itself is already, our technology is within the unit. So if you can think of like a box, right? So we have small boxes with smaller active pure cells in them. And then we have large boxes with active pure in them that might have 4 active pure cells instead of 1 or 2. Now, through the humidity and air, it goes through what's called, we call it a honeycomb matrix. It's also then coupled with UV optics. And when it goes through that chamber, that's where the molecules or all the, say, the patented technology is happening. And that's when the molecules are then sent out into the environment. So, that's basically how it's developed and then, again, put out into the environment.
Let me just digress on UV optics. That sounds like ultraviolet light.
Yes.
The kind that has been used in many of the units, that I've heard of before this one. And how does that play? Because you're talking about sending out these organic chemicals, peroxide and the like, hydro. It sounds like what Trump was calling hydro. I can't even pronounce it anymore. It's history. Hydrochloroquine, hydroxychloroquine. Remember, it sounds like something like that. It really does. So how do you generate that? What kind of technology, what kind of process do you need for that? And how does that play with the ultraviolet light?
So the ultraviolet light that I would say we're more accustomed to, especially in the restaurant setting, would be the wands. I think we all seen wands that fan over certain high touch points. So that technology is somewhat utilized into this machine. So when it's going through our, and I wish I could, maybe pop up a video. We can do that on another time, and really dive in deep into how the technology works. But through that honeycomb matrix, through the UV optics, UV light, it gets created in that chamber. And once when those hydroxyls and superoxides and hydrogen peroxide gets released, we have to understand a virus has an outer shell. Okay, so the pearls of that outer shell need to get pierced in order to basically break it up and then diffuse that virus, right? So COVID-19, just to share with you, it's not a very hard virus to kill, to be quite honest. So the outer shell of that, easy to pierce. Our technology and our science has proven with a BSL level 4 lab. I'll kind of go deeper into the technology and our testing. If you look up BSL level 4 laboratories, there's only 13 in the world. There's only 4 in the United States. The laboratory that we went to was at Texas University. So our technology, being that we have a seal of approval with science certification, we are a technology, we are the only technology, I should say this, that is of air purification inducted into the Space Technology Hall of Fame. There's other products that we know like LASIK, we know that the pacemaker, we know satellite imagery, satellite radio, GPS. This is all other technology that we are rubbing shoulders with in that Space Technology Hall of Fame.
Terrific.
So in order to get there in that BSL level 4 lab, one, we're vetted. Number two, we got our hands on the live human strain of SARS-CoV-2. So there is different strains, different variants of the virus that we need to, when you're doing your homework and you're looking at other purification systems, really look at their studies and their technology, but look at the studies because you want to make sure that the company that you're buying from is one vetted and it's been through the rigors of a lab testing.
Sure, but this kind of black box thing, a scammer could come around and make believe that his black box works, and you wouldn't know if you didn't research it in detail.
Absolutely, and we've been hearing feline strains being tested upon. We've been hearing other proxy, SARS-CoV-2s that have been used to kind of lift or elevate the product that, maybe is superior or not superior to ours. But you will not find this technology available on Amazon, eBay, any of those outside sources, because we want to make sure that we get this into the right hands of folks, but they're not buying the wrong product to treat maybe a undersized or oversized space. So that's why you would really want to come to me. And we don't take the cookie cutter approach. We really want to know your space, how you use it, how you move around it. If we need to elevate the
so you can make it most effective. I suppose the idea is that the installation, the deployment is going to have an effect on how well it works.
Absolutely.
And you want to take a look at that. So, but back to the way it works is, I take it that it is sending out these vapors, if you will, into the environment in the restaurant, into the air in the restaurant, and that's where it attacks the virus. That's where it penetrates the membrane, whatever it is, the skin, the shell of the virus, and
Yes.
kills the virus. And it does it by virtue of these organic chemicals you mentioned.
Yes.
Okay, so that means that you have to reach all the air in the restaurant, and you have to get a certain flow of the air. So is the device that we're talking about, does it have a fan? Does it have some kind of system where it can make sure that in the product of its vapors is all over in every corner of, say, a 2,000-foot restaurant?
Absolutely. So each of these, say, boxes that we build, what happens is there's large ones that can actually cover 20,000 square feet. So the CFM fan that's within that unit is obviously a lot more powerful than one that's only, say, we make these for automobiles, so perfect for fleet, distribution or delivery service for a restaurant. Those would go right into the cigarette lighter, and it would keep, say, the drivers safe. As they're leaving the restaurant, that's, let's just hypothetically say they have it in there or in their offices. When they get into their vehicle, they have it there, and then when they come back, they have it there again. So it's creating that 360-degree protection. And that's really on the consultative end, where I come in and I say, hey, look, if you have this door closed and it's an office space, you probably need a smaller unit to protect that space.
So you might want to have multiple units in various places in the restaurant, depending on the airflow and the people traffic and so forth.
Yes,
And
yeah.
does it go on the floor, on the ceiling? Does it go along the wall? Or what's the optimal height off the floor?
Yeah, so a couple of things I'll mention is, one, we have systems for HVAC. We have in-duct systems. So not just portable where you can roll it in the room, set it up and forget it. We have cordless type of products as well, where you just plug it in. There's anti-theft things, so people can't walk out with it. But a lot of, thought went into putting, okay, if we put a portable unit, how do we keep it safe and not, walk out of the business, right?
Yeah.
But to elevate it, here's a good example. So a gym that we're talking to right now, because this is not only restaurants, this is for retail,
Sure.
residential, commercial, military.
Right.
But for a gym we're talking to, they need every square inch of that floor space. So what we've done is we said, hey, put one in this corner and put one in this corner, and this entire gym will basically be covered. Now you need a smaller one in your office because that door stays closed at times. And, for Zoom meetings, like probably what we're on, they want that privacy, right? So we'll put a couple big units in there. Say the room is 4,000 square feet. We'd probably recommend 2,000 square feet units for the gym. And then if the office is, say, only 500 square feet, we would put a small one in there. And that would afford the business to say that they are 100% active pure technology protected.
Is there a way of testing where you can either have a schematic of where the air is flowing around the room, or you can actually verify in some way? I'm reminded of some tests that were done in Japan on people sneezing with COVID. They used some kind of ultraviolet or infrared light technique to identify the molecules, and that way they would know how far the sneeze went. I mean, is this possible with the device you're talking about?
You brought up something really interesting. One is they did a study back, I believe it was Purdue University. They talked about the spread on airlines or airplanes, right? So if you're in row 50, you can actually spread it throughout the entire plane. One simple sneeze will do it. The recommendation, I'll say this, for CDC guidelines is 6 feet social distancing, right? But in reality, it's only 3. What they've done is they basically multiplied it by 2 and said, hey, general public, stay 6 feet away. Now, what our technology is doing, it's working within that 6 feet. or 3 feet. 3 feet is the danger zone, though. I want to make sure people know that. That's where droplets, we know this is an aerosol type of virus, but this goes beyond COVID. You know, this technology can work on the norovirus. We have testing on that. That's something that plagues restaurants. Mildew, mold, odors. If your restaurant is suffering from any type of bad odors from your carpet, or you just don't know where it's coming from, this technology will definitely help. We have multiple studies in all types of situations. Our latest study, I'll share with you folks this. We haven't published it. It's not in the Associated Press or Huffington or Forbes, but we are doing a double-blind study with Cleveland Clinic, where we have outfitted their surgical rooms and ICU rooms with 50 of our units. We are doing this testing for 2 years. So we are gonna most likely see the number is 65 to 85,000 individual patients come out of their surgical rooms and ICU rooms. At that point, we're gonna have obviously 2 years of data to share with other safe facilities. If anybody knows about the Cleveland Clinic, it is one of the most state-of-the-art clinics in the world.
Well, we want that. And, these days, there was an article in the paper a couple of days ago about how people are not going to doctors and hospitals in the time of COVID for regular, more routine visits because they are afraid that the doctor's office or the hospital will have COVID in the atmosphere or the surfaces, and they'll get sick, even though, they need to visit for other reasons. What about the notion of the air, which is contaminated which has virus, sits in the room? It sits overnight, and ideally, I'm really asking. Ideally, you would have this thing running 24/7, because it's you always want to get that stale air. You always want to find that last molecule of COVID and keep it turning so that it never stops. Is this what you do with your device?
Yeah, so what we do, Jay, is we set these up with the notion that they will never be turned off until you move locations or whatever. But yes, definitely, it's going to be running 24/7, 365. The machine never gets tired, never calls in sick. It's working 24/7.
That's great.
There's no labor involved. So this is something that will, if restaurants right now are doing their own internal disinfecting, using the UV lights or fogging or some, whatever they're doing, we're really encouraging them to look at our technology so that they can make better decisions for the company, really, and look at it from a labor intensive standpoint. There's no chemicals, tablets, there's no water needing to be added. You don't need to clear the room. I've actually.
Well, how do you get those chemicals to come out of it if you don't put anything into it?
So this is where our technology really comes into play. So when you look at how it's getting these molecules and converting it, it's really just taking the humidity in the air and the oxygen that is naturally in our environment already, and no other technology can say that it takes those two molecules and converts them into, again, the hydrogen peroxides, peroxials, and the superoxides.
Do these chemicals, if I breathed in a whole bunch of these chemicals, as a test, would they have side effects on me? Would they have any negative effect on me?
No. So this is definitely safe on pets, safe on humans. There's no byproducts of it. So, I do want to share, like, with the fogging machines, I know a lot of businesses are using them right now. So if you ever sprayed that on glass, you may already know where I'm going, that you may need to replace your windows. It's because they have byproducts on them, and it can damage your windows. Our technology, none of the above. No.
Oh, terrific. Sheryl, this sounds pretty good.
Right.
And as John has intimated, that it's not limited to restaurants. So if you were considering, Sheryl, to get this, in your office for the Hawaii Restaurant Association, you'd probably want to know how much it costs. So why don't you take this opportunity and ask John how much it would cost for your office?
So John, my office is around 800 square feet. 750, 800 square feet. So what to do this system within my office, how much would it be?
Your office, does it have any other rooms or bathrooms, restrooms in it?
Yes,
How many?
it has 3 rooms and 1 restroom.
3 rooms, 1 restroom, 4. Okay, so you would need 4 smaller units. I'm not going to say which units yet because I don't know the space, right? But you would need 2 smaller units. And then all you would need is probably one that covers 1,000 square feet for the main traffic area that I think visitors and people that would come in more frequently. The rule of thumb, though, I would say is $1 per square foot.
Okay.
That's what you would use as a rule of thumb.
So
Sometimes
if I was doing a restaurant, which the proverbial restaurant for the 2,000 feet, $1 per square foot, that would be $2,000.
Yes, sir.
And of course, you have to have a maintenance contract just in case it stops. Do you offer maintenance contracts?
The nice thing about most of our units, or I said all of them, comes with a warranty. Most are 3, some are 5-year warranties. So the I would say the manufacturer in Bristol, Virginia, is backing the product on any things that would happen, regular wear and tear that would happen within the machine for 3 years. There's no 1 years. I think everything is either 3 or 5 is what I would say. I'm going to be I'm the guy on the ground. I'm the Aris. Aris is our parent company. They are in Texas, Dallas, Texas, but we are in almost every country. We are already, our technology is in with Mitsubishi in Brazil. This is in the Texas Capitol. This is at the Ground Zero Museum in New York. This was deployed after 9/11 at the Pentagon, where we received 2 awards from the Pentagon in response to that. We have other, Major League Baseball. If you're one of those guys, we do have our technology in 29 of the clubhouses there. The only one that's it's not there is the Oakland Athletics. That's the only MLB team we're not in. But a lot of this technology I want to bring to Hawaii. I want people to know about it. But more importantly, I'm telling you folks now that we're making it affordable. This technology should be way more expensive, in my opinion. But we are committed to safety and the health of our local people here on island. I am not using mainland prices. I am not doing anything of that nature. With a $2,000 investment, I can almost guarantee you have spent probably 3 or 4 times that much on disinfected products already. So here's a solution.
Well, it's also public confidence.
Yes.
But let me go and move to another way of looking at this, and that is sure, restaurants and Sheryl and I can tell you that it's a matter of public confidence. People should feel that restaurants are safe. This is really critically important. People right now, these days, are asking, is it safe? Can I, like the marathon man, is it safe? Can I go out to a restaurant, have a meal with my buddy, and be personal? And that's important. But when you talk about this technology, and when you for example, cover Sheryl's office, that means everything. Let me add too that it's become clear in the course of our public information about COVID is that that we have variants of these viruses. We will continue to have variants of these viruses. We will have new viruses, new antigens, of every kind of nature in the world today, that hurt people and that are infectious. And so it seems to me that the new world we are learning about right now is here to stay. And therefore, that air purification is here to stay because air is obviously one good way to transmit the infection. And so if you can cut it out in the air, well, you can make life a lot safer in many ways. So if I was running an office, if I was running a studio, I would definitely consider this kind of technology for the safety of my employees and my visitors and suppliers and all that stuff. It would have to be quiet. I think you've said that it is quiet. And it would have to be effective, and it would have to be no fuss, no muss, 24/7, always keeping things clean. And I'm telling you before the show that, I have a doctor who has air purification systems in his waiting room, and I said, "Oh, that's interesting. Is this temporary?" And he said, "No, it's not temporary. It's forever, because the situation is forever." So, if we look at it that way, John, look down the pike, we can see a need, an objective, rational need, and a demand out there for years to come. I mean, maybe forever to come. And the question is, where does this kind of marketing arrangement you're talking about, not in Amazon, not in Costco, not in Long's drugstore, which requires your special mojo to install it. Where is that going when I tell you that in years to come, every person I can think of will want to have this in some fashion or another? What happens? What happens to your company, Hawaii Air Solutions? Don't you think it has to go wide?
Yeah, I mean, we right now the introduction of this to the state of Hawaii is really coming from myself. I do have a couple other partners. One is in Canada. He's an aeronautical engineer. He basically goes and works on spaceships. His name's Byron. I'll mention Brian. Brian is out there in Colorado, and I'll mention Jim. They'll probably watch this as well. But out of the three partners that I have, we understand capacity. We know that this is going to be an issue. Maybe here in Hawaii a little bit if we start seeing thousands of units move, but we do have commitments from our manufacturer that we can ramp up to 25,000 in 30 days if need be. So capacity is really not an issue. But I did share this before, where we do want to make sure that people are buying these units not as a gimmick or as a hobby or as just a fly-by-night product. This definitely needs to have some thought and processes in it so that we can better equip that business or residential customer the way that they utilize their space. I think that's the thing I want to touch on, is that, or make a point of, is that we need to make sure that we know how you utilize your space, because right now there's a lot of places sitting stagnant, and some are suffering from what's called sick building syndrome. This is a lot of places that maybe have a warehouse or maybe have a separate room that maybe isn't utilized because of COVID and its occupancies, right? So those particular locations within your business, or let's say in your home, if you're not using it readily like you were pre-COVID, need to be addressed. Several things are happening in those rooms. Not only molds, bacteria, fungi, mildew. This technology helps with all of that, but you could be seeing other spores kind of just picking up. So we really need to look at those types of places. And these are the conversations I'm having right now with a lot of the business owners. And I must have been on like 12 Zooms within the last 2 days talking about this and sharing this technology.
Good. Well, you're at the front end of something. And I suggest that what you are learning, about the proper way to install, use, recommend, what have you, the charts, the graphs, the floor plans, all that, is something that can ultimately and will ultimately be codified. And so I could see a time where I could go to Costco or go to Amazon. It'll say, well, you have an 800-foot office, and you have this anteroom and that bathroom and so forth, and this is what you do. And granted that it may not be as refined as what you would tell them, John, there would be instructions like the user instructions we get with so many things we buy. And it'll be up to them to follow the instructions. So hang loose on this, because I think you're going to see a tsunami, either in the products that you're developing and learning about and implementing, deploying, or in competitive products that are going to see how successful this one is and try to emulate you. Yeah. Okay, I think we're almost out of time, Sheryl. So I'm going to turn it over to you to make some profound summarization. What do you think?
Yes, Jay. So as we've seen, COVID has proven that our attention needs to shift to indoor air quality. in our restaurants, in our homes, and in our offices and all businesses. And restaurants are using the science-based systems that John is talking about in our dining rooms. And this is paramount in protecting our employees, our guests that visit our restaurants, and in general, our community. So Hawaii Restaurant Association, again, is the voice of Hawaii's food service industry. And as always, we're looking for all kinds of ways to ensure that our guests' dining experiences are superior.
Yeah, and John, I assume you have a little sign, a little label that a given restaurant, sort of like the Department of Health, with the, ABC, whatever it is, that the restaurant owner could hang there and saying, we have this technology, this Hawaii Air Solutions technology in our restaurant protecting you. I mean, is that available? Are people using it?
Yes, absolutely. So there's window decals, to be affixed wherever you want people to see it while entering the building. We'll also provide, obviously, marketing tools that you can use in your business's, say, marketing strategy with logos, videos. We are stretching into the marketing aspect as well. So what I'll be doing is I'll be partnering up with some of our local videographers, and we'll be actually offering something of that video intro that maybe the restaurant doesn't want to, talk about the technology, but we will. Our team will basically go there with the video guy, and we'll be able to share the who's and what's about the technology. But you said it, Jay, we want people to feel safe. We want people to understand that you can come back into the dining areas. It's protected by this technology. We are just real short. We want to make a push to help our retail and restaurant associations and businesses to see that little tier. We were in that tier system to move up the notch. I think if we bring a science-based technology into this conversation, we can start to see more prudent reopening strategies. We have never really addressed the indoor air quality the way we should be. And I think now's the time so that we don't take 10 steps back like we have been the last few times we've reopened.
Now's the time, not only for patrons who are local, but for the tourist industry in general. We want to, project an image out there to the world that we care about making it safe in a time when there is still some danger. Well, thank you, John. John Kaihui and Sheryl Matsuoka, thank you very much for helping us understand this technology. And I look forward to seeing one of those labels in a restaurant near you, near me. Thanks so much. Aloha, you guys.
Aloha.